Good afternoon once again. Sawasdee krap. Today is Monday, the 23rd of August, 2021, and this is the English language summary of the daily press briefing here at the CCSA as always. So thank you to Dr. Tui Sin for the Thai language edition of the briefing just now. He outlined some important issues, some important updates that I'll be summarizing for you here. One important issue is, firstly, just to be aware of the online scams that are quite circulating quite often here in Thailand. And I'll go to that in a bit further. So we have the first issue is about the general situation and the number of cases that we have for today. If you note that the number of Thailand in the ranking is rising, that's true because right now we are at number 33 in the global ranking, but hopefully the number will not rise soon. Now, the numbers are getting a little bit stable in terms of the new confirmed case. So recorded for today, we have new confirmed case as follows: 17,491. That is the number of new confirmed case that we recorded for today. You see that in the blue box on the left on screen right now. And of this number, 7 cases are from overseas arrivals. We have from this number 2,072 from active case finding, as well as over 15,000 from walk-in infected cases. Now, as I mentioned, the number of new confirmed cases is getting stable as compared to the past weeks. It has been getting stable for a couple of days now, decreasing from around 20,000, being lower now to a bit over 17,000. Now, we have the number of new recoveries recorded for today. It is also actually getting farther away from the number of new confirmed cases. So new recoveries, we have 22,134. That compared to over 17,000. So almost 5,000 difference. So I hope that this will be a good trend, that we have more new recoveries than the new confirmed case each day. Now, just to note that for the numbers, here at the CCSA, we try to provide the most accurate daily numbers for you in terms of the new confirmed case, in terms of the fatalities and new recoveries, of course. Now, there might be some discrepancies which we have discovered. For example, those who have been found positive by ATK method, the antigen test kit method, may be the same persons who have been asked to take the RT-PCR test as a second test. So therefore, there might be some duplication in the number of cases that we have. So we'll try to sort that out to provide you with the most current and most accurate information. Another issue which Dr. Tui Sin mentioned is importantly about the breach of measures. In his charts, we had around 6,000 cumulative breaches of the various measures, including those who travel between the provinces of the dark red zone and the red zone. We have, in terms of the numbers also, 242 new fatalities. So the cumulative total of fatalities now is 9,562. The 242 new fatalities, mostly for today, is found from Bangkok, 79 to be exact. Now, the new confirmed cases the number is getting stable, as I mentioned, but in terms of the fatalities, we are still having a high number of fatalities on the graph. If you saw the Thai version just now, the graph that was shown by Dr. Tui Sin still shows a high number of fatalities. Hoping that the number of new fatalities will not increase, hoping that they will decrease, just like the number of new confirmed cases. Now, that just comes to point that we must remain steadfast in our efforts to inoculate the highest number of people possible, particularly those who are in the vulnerable group, meaning the 60-year-old and above, those with 7 underlying diseases, and those who are pregnant as well. In Bangkok, this group, around 80% and above of this group had already been inoculated. And we hope to inoculate a higher number of these groups of people, 60-year-old and above, in the provinces as well. So therefore, if you are not in these groups, our wish is that you open up the opportunity for these groups to be inoculated at the earliest opportunity and remain steadfast in this effort. Of course, an important keyword is universal prevention. We mentioned that last week as well. Universal prevention is very important for us to control this pandemic. Now, for the vaccination rate, let's turn our attention to the national vaccination rollout. We have recorded yesterday an additional 206,000, over 206,000 doses of vaccine administered. In cumulative numbers, you see that on screen, we have over 27 million doses administered already. And in terms of the doses reported yesterday, over 206,000, you can dissect that into first dose, as you see on screen, second dose, and the third dose. And so far, as you see, over 1,700 have received their booster dose. This is, of course, reserved primarily initially for the medical professionals and the frontline workers. The aggregate total, as you see, is 27 million, and can be divided into 20 million having their first jab and over 6 million having, roughly 6 million having their second dose already. Now, the current global outlook for new infections seems to be stable, and the same observation can be said for Thailand and the neighboring countries in terms of the new confirmed cases. Now, moving on to the issue of the purchase of additional Pfizer vaccines, and of course the online scam, which Dr. Tuisin mentioned also. Last Friday, the Public Health Ministry signed a contract to purchase another 10 million doses of Pfizer mRNA vaccines, raising the total to 30 million doses for delivery by the end of this year. Now, the Disease Control Department Director General signed the supply agreement for 20 million doses of Pfizer on the 20th of July, and the Cabinet approved 9.3 billion baht to procure this new batch. This was last Tuesday. And these procurements are part of the Disease Control Department's plan to purchase 100 million doses of various types of COVID vaccines by the end of this year. For Pfizer in particular, the estimated arrival is the fourth quarter of this year. And regarding the online scam that I mentioned in the beginning, Dr. Tuisin highlighted that currently there is some sort of circulation of an online scam wherein you would have to pay to receive Pfizer vaccines. So please don't go into those websites or links, and be very careful. The Pfizer vaccines to be procured will be free of charge, and will be arriving at the fourth quarter of this year. Another piece of information important for the English language audience and those viewing us from outside Thailand as well is regarding the Samui Plus program. If you recall, we had the Phuket Sandbox, and now it's the Samui Plus programs, particularly regarding the flights between Samui and Phuket province, which will be resumed on the 25th of August. So Surat Thani governor, the province where Samui Island is, said on Friday last week that 257 inoculated foreign tourists had arrived in Samui after spending 2 weeks in Phuket under the Sandbox scheme. So this is the 7+7 scheme. However, the flights between Phuket and Samui had been suspended from August 3rd to the 16th and has now been extended to the 31st of August. This meant that no tourists could arrive from the Sandbox in Phuket directly. But he said that after consultations with all stakeholders involved, the flights on the Phuket-Samui route would resume earlier than scheduled. The Bangkok Airways is now scheduling flights between the two islands on the 25th, 27th, and 30th of August. This will boost the number of tourists arriving under the Samui Plus scheme, which encompasses Got Samui, Got Phangan, and Got Tau. And of course, this is according to the analysis of the daily situation that we have. The governor further revealed that from the 15th of August until November of this year, 168 fully vaccinated tourists had already made their bookings for Samui, with reservations for 2,149 hotel nights, an average of 12.7 nights per visitor. So this is good news, and this reservation was made by foreign tourists from various countries, including tourists that are French, German, British, Austrian, American, and also Thai tourists as well. So just on a last note, Dr. Thuis had mentioned about some international sporting events which were proposed to the CCSA to be held in the coming weeks and months, and that had been approved by the CCSA, of course, in the important measures that are set. You have that on screen, some of those samples of those events, 2 futsal events and 1 volleyball event. I think we have a couple of slides for you here. And there are some examples of that to be held in the months ahead, for example, in October. And rest assured, with the very important measures in place. As you can see, the world witnessed the Olympic Games in Tokyo a week or so ago, and that was held with the various serious, important measures. And this will also be upheld in the various sporting competitions and events that were approved by the CCSA to be held in Thailand. So with that note, I thank you very much for your attention, and we'll see you again next Wednesday. สวัสดีครับ
ครับขอบพระคุณนะครับท่านณัฐ